Hi there, I'm Dr. Robert Szyszewski. I'm a nephrologist, or in other words, a kidney doctor. I'd like to welcome you to this edition of Facebook Live. Today, along with Annie, my friend, will be discussing the topic of diabetes, cardiovascular disease, and kidney disease, and what you as a patient can do to help yourself. Hopefully, we can provide some useful information and answer to a few questions you might have about these issues. Now, before we begin, I'd like to let you know that this program is being held in conjunction with National Kidney Foundation, the Diabetes Sister, and Women Heart, the National Council for Women with Heart Disease. Why don't we start with a statement that diabetes is the most common cause of renal failure in the United States. How it's usually diagnosed is that the patient goes to the primary care physician, and he or she follows up very closely on diabetic issues. And at one point, the primary care physician discovers that either you have protein in a urine or abnormal blood work for the kidney. What abnormal blood work for the kidney means is that usually doctor performs a routine blood check, and that involves checking also a creatinine level, which reflects the kidney function. To make it very simple, creatinine is basically a waste product that is made by our own body, and it goes to the blood, and then blood takes that creatinine to the kidneys, at which point kidneys are responsible of putting that creatinine in the urine. So if someone has elevated creatinine, that actually means that both of your kidneys are not working well. Well, you may ask me, how do I know that both kidneys are not working well without looking into anything inside? And the answer is very simple, because if you have only one normal kidney and the other kidney is not working at all, creatinine should be normal. In other words, one kidney has enough power to clean the body from poisons and toxins. So again, in summary, if someone's creatinine is elevated, that means that both kidneys are already affected. The second very important point is that this process is usually painless. Therefore, you should be aware that your kidneys should be checked, especially if you have a diagnosis of hypertension and diabetes, because at no point of the disease you should feel any symptoms from the kidney. There will be no back pain. There will be no problems going to the bathroom. Now, if we measure creatinine and we just have a number, the same number for different people means actually a different kidney function. Therefore, that number has to be calculated by your physician, and the kidney function has to be expressed in something called estimated glomerular filtration rate, or something called GFR. What the GFR means, it provides more accurate description of the kidney function. In other words, if someone's creatinine is 1.5, for example, for you and for me and for somebody else, it means that the kidney function is different, because that creatinine has to be also calculating the content of someone's age and body mass and sex and race in some circumstances. Therefore, creatinine has to be converted into a GFR, which sort of reflects kidney function in percentage of kidney working. When it comes to kidney insufficiency, doctors would like to describe that kidney insufficiency in stages, 1 being very mild, and 5 basically when the kidney function is not there, and some people will require renal replacement therapy in form of dialysis or kidney transplant or in other forms. When it comes to the treatment of diabetic nephropathy, there are a couple of points to take home. Number 1, the most important is that the best treatment for your kidneys at this point is to continue with excellence in blood pressure and blood sugar control. Even if you are taking all the other medications for the blood pressure, you watch your diet, you go to your physician, a daily control and excellence of blood pressure and blood sugar control is the most important factor in delaying or preventing your kidney disease. The second thing is that there are specific blood pressure medications that your doctor might prescribe, and these are not just any blood pressure medication. There is a special group of medication called ACE inhibitors, and the advantage of these medications is that Besides lowering blood pressure, they also change the way blood flows through the kidney. So as a result of that, the kidney is getting more protection, and therefore the onset of kidney disease comes later. The next point is that if you already have protein in the urine, there may be an additional benefits of limiting your protein intake with daily food. And the whole idea is that, number one, kidney does not like protein in the urine. If there is a protein leak, that means that somewhere along the kidneys there is a little bit of damage that creates a situation when protein is leaking from blood to the urine and kidney doesn't like it. In a matter of fact, protein itself is making the kidney function worse. So even if someone doesn't have diabetes or high blood pressure, if for any other reason there is a protein leak, that protein can create potential damage to the kidney. So at one point when patient has already a specific amount of protein in the urine, restricted protein intake is very important. And there are specific recommendations that you can discuss this with your primary care physician or with your nephrologist during the visit, and they can instruct you about the amount of protein you are able to consume. Now, believe it or not, also smoking cessation is quite important for the kidneys. We're not going to focus today on the lung diseases, but if you have diabetes and if you continue to smoke, actually it was proven that smoking can facilitate kidney insufficiency and leads to some serious kidney issues. So that's the introduction. And Annie, why don't you tell us how you first discovered that you have problem with the kidneys, and how did you end up seeing a kidney doctor, and how did we manage your kidney disease?
Well, my discovery of having kidney disease didn't come about just through going to a regular appointment and having blood tests. I wound up having a kidney stone that embedded itself in my kidney, and I didn't know it. And with each blood test, the test would show my kidneys weren't doing as well from visit to visit, but we didn't know the stone was there. At a certain point when we discovered the stone was there, and my kidney function was rapidly decreasing, I had the kidney stone taken out. Now it improved slightly, but I still had an underlying kidney disease that had to be taken care of.
Right. So actually, Annie was lucky in a way that she had a kidney stone, because that brought an attention to her kidney issues. And initially, we thought that after taking care of the kidney stone, kidney is going to return back to normal. And unfortunately, it didn't. And then further studies, including a sonogram and additional blood work and urine test, lead us to believe that you have diabetic nephropathy, which is basically an elegant name of diabetes making damage to the kidneys. Now, and you also remember we have some conversation about the contrast issue, so maybe yes, you're going to let us know how was that related to your kidney health?
Well, when I first had a heart attack, they gave me stents, and to put the stents in, they used a dye. And afterwards, I wasn't feeling well, but I figured that went away. Then I had other stents put in, and it was after the third time that I had a stent put in quite a few years ago, I went back to the hospital, and they immediately took blood tests and said, your creatinine level does not look good. And they immediately readmitted me and started flushing my kidneys with saline for 24 hours. And I found out that I should never have contrast dye again because it affects my kidneys so much.
Right. So never say never, but obviously contrast is not directly related to diabetes. However, very often diabetes is not leading only into the kidney disease, but cardiovascular disease. And patients who have these issues at one point may require an injection of a contrast, an injection of a dye, for the purpose to see another organ in your body and see what's wrong with them and fix it. Unfortunately, that dye is also not good for the kidney. Kidney doesn't like it. So whether your kidney is healthy or whether the kidney is already having some issues, especially when you have diabetes, contrast can actually speed up the progression of the kidney disease. So it's very important. Sometimes we are in a situation that contrast cannot be fully avoided and the patient has to have a contrast, but there are also specific ways of preventing or decreasing the potential damage of the contrast to the kidneys. So again, if you are aware about having elevated creatinine level and you're about to have a test that involves injection of a dye, always please make sure to alarm the physician, because again, there are specific ways of decreasing that potential damage. But let's go back to diabetic nephropathy. So after we fix your kidney stone and you already went through the contrast, and we thought that maybe contrast in some degree contributed to your kidney disease, our conclusion was that at least in some degree you have underlying diabetic nephropathy, which is again diabetic damage to the kidney. How do you understand that process, and what do you think you can do, and what do you understand that you can do to decrease potential deterioration of kidney?
Well, I've learned a lot since this has happened. Initially, I didn't know that there were connections between the health issues. I had no idea that heart disease and diabetes were connected. I had no idea that kidney disease was part of it. So it's been a huge education curve for me. Working with you, I now go to an endocrinologist who has given me some excellent advice. They actually put me on a continuous glucose monitoring, I guess, I don't know what you would call it, but a meter. And that way they were able to see what my blood sugars were like throughout the course of a week. So one of the things I do is take my blood sugars frequently, and that'll give me an idea of how I'm doing with what I'm eating and how it's affecting my body.
Right. So again, if you remember that from our discussions in the office, it is again quite important and probably the most important thing in diabetic nephropathy, which is control of the blood sugar and the blood pressure, right?
Yes.
We also have been discussing about going regularly to see an eye doctor. And I hope you remember from one of the visits in the office that I told you that there is an additional benefits of going to the eye doctor for the kidney, because when you go there, he can actually dilate your pupils and he can see the vessels at the back of your eye, something that I can't and I'm not able to see in your kidneys. And I think I also told you, Annie, that the size of the vessels in the kidney and the eye is about the same. So very often if you go to the eye doctor and you see that there are some changes in the eye, you can practically assume 100% that there will be also changes in your kidneys, because again, the size of those vessels in those two organs is the same. And one would imagine that if it's affecting the eye, it's probably also affecting the kidney.
I'm very aware of that. So I do keep my appointments with my eye doctor, and they fully dilate my eyes, and I'm happy to report that they say that there's no damage, because that's something that they look for each time to see if there have been any changes in my eyes, and things at this point, fortunately, are stable.
I'm very happy for you. We also cover a topic, Annie, during one visit, and that was by your request, about approaching possibility of end-stage renal disease, at which point you might be requiring some form of renal replacement therapy. And I believe I told you that creatinine level, again, being changed to percentage of kidney working, and I told you that once that number is approaching 20, you would be allowed to go to a transplant center and register yourself and make your line to hopefully receive the kidney transplant in the future, if it comes to the point that you're going to need one. We also did cover a topic about possibility of going into dialysis in the future, and therefore I refer you to a program which is sponsored by National Kidney Foundation called Kidney Options. and I think you did attend and you learned about different form of modalities.
Yes, that was quite an eye-opener. I know people that have had dialysis, but it's not the same as sitting there with someone who's explaining the different techniques or the methods that you can do dialysis. And I also went to the transplant center and registered so that I can be on the transplant list if I need it someday. So again, it's a lot of education about things that I had no idea about.
Okay, well, hopefully it's not going to the point that we will have to think about any sort of renal replacement therapy for you. I know your numbers for quite some time, and they're pretty stable, and you're doing an excellent job. You deserve A and 2 pluses.
Thank you.
Annie, we've been also talking about some other complications that result from renal insufficiency. They may be a little bit more complicated, but we did cover a topic of anemia secondary to renal insufficiency, and also bone disease and something called secondary hyperparathyroidism. Tell me something, do you remember anything, and do you have any idea how to approach and manage those?
Well, I do know that my anemia level is getting to the point where I may be able to get a shot to improve my, I guess, my red blood cells.
Very good.
Yes, that I remember. And I do find that I can go like the Energizer Bunny, but then I fall. And when I get exhausted, it's not something that I had happen before I had anything to do, any problems with my kidneys. So I find that there is a difference in that. And as for, I guess, the treatment, it's a matter of staying current with all my blood tests to see where the range is, and then I'll find out if that's something that I need to take.
All right, so maybe just for the educational purpose and refresh the memory, patients who have chronic kidney disease eventually will have a tendency to develop an anemia. And this is not because of the lack of iron or lack of vitamin B12 or folic acid, but this is actually because kidney, besides cleaning your body from poisons and toxins, is also producing a hormone called erythropoietin. And some patients actually call that EPO, to make it simple. And that hormone goes from the kidney through the blood to the bone marrow and sends the signal to start making red blood cells. So in other words, if you can imagine you're trying to build a house and you have B12, which are your bricks, you have iron, which is your plywood, you have all the materials, but you actually do not have a builder to build the blood. So by checking your hemoglobin during visits in our office, we also check your iron, and at one point I told you that once the hemoglobin is going to reach a certain level and you're going to become symptomatic, you might require Procrit injection, which is nothing but the hormone that is produced by the kidney, and we give this in the form of an injection. It's actually very simple. You give it under the skin, almost like a flu vaccine, and that slowly rebuilds your blood to the level at which point you feel less symptomatic. Do you remember anything, Annie, about the bone disease, which is a little bit more complicated?
I do remember we discussed that, but I'd rather have you discuss it so that everybody understands actually what it's about.
So besides the fact that the kidney is cleaning the body and producing the hormone for the anemia, kidney is also responsible of very close balance, keeping very close balance between the calcium and phosphorus in your body. And through very quiet, complicated mechanism involving metabolism of active form of vitamin D and small hormonal glands that sit in your neck called hyperparathyroid glands, called parathyroid glands, these levels will be dysregulated once you have kidney disease. And not to complicate things, but basically if you have renal insufficiency, if your creatinine is elevated, you are at higher risk of that condition. And the whole idea is that your phosphorus is going to go up once your calcium is going to slowly go down. And that sends a signal to the small hormonal glands that actually sit in your neck. And to make it a little bit more confusing, they call parathyroid glands. Very often, when I do mention this topic to the patients, they jump in conclusion saying, no, doctor, my thyroid is fine. This is not exactly thyroid gland. It's just that the gentleman who discovered those glands, he found them sitting behind the thyroid glands. Okay. So he called them parathyroid glands. And as a response of this disbalance between calcium and phosphorus level, that hormone will go up. And again, you're not going to have any symptoms. Nothing is going to hurt in the neck. However, if you have persistently high level of circulating hormone, parathyroid hormone, or PTH, that is also leading to vascular disease, involving increased risk for having a stroke or coronary vascular disease. So again, that's yet another reason to go and see a nephrologist on occasion to make sure that you are screened for that condition, because it's very easily treatable. It's managed by medication. It doesn't involve any injections. It might be a need to do some additional dietary changes, restricting your phosphorus intake, and therefore that will decrease not only risk factors for your kidney disease, but it will decrease the risk of you having a heart attack or a stroke. We also, I believe, spoke once about taking phosphorus binders, right?
Yes. That I do. And since we discussed that, I take the pill that you prescribed with my largest meal, so that if the foods do have higher levels of phosphorus, it's taken care of. Right. And actually, one of the other things I did that was helpful was to go online and look up foods that are very high in phosphorus, so that it would minimize needing it if I'm able to cut out some of those foods.
Right. So that is actually because of the topic that we just covered, the secondary hyperparathyroidism. There is a tendency of phosphorus accumulating in someone who has chronic kidney disease. And the reason for that is that basically your kidneys are not able to excrete it. They don't have enough power to handle that additional phosphorus. Phosphorus will start accumulating in the body of a patient with chronic kidney disease, and that is again another risk factor for getting vascular disease. So high level of circulating phosphorus will lead to vascular disease, including heart attack and strokes, and that's an independent risk factor for having a vascular event. The idea of you taking that pill, Annie, is because your kidneys don't have enough power to handle that phosphorus. So by you taking the binder, binder dissolves in your stomach and actually grabs those extra particles of phosphorus and prevents it from being excreted. So that's one of the ways of managing the secondary hyperparathyroidism and decreasing the risk of vascular disease. I also did mention during one of your visits that at one point there may be a need for an additional pill which will directly lower the level of the hormone produced by those small hormonal glands that I did mention. But you're not at that stage yet, and hopefully you will never need that additional pill. At this time, why don't we take some questions from the viewers? On the subject for myself or for Annie, please post it on the comment section and we'll do best to answer as best as we can. We have a question, I think. Tell me about your diet. Why don't you, Annie, address this? You're an expert on that by now.
Well, one of the things that I do specifically to control my blood sugar levels is to restrict my carbohydrate intake. And that way, when I do my blood sugar readings, I'm not having wild numbers. And since I have the kidney disease, I can no longer take certain oral medications. And so this is something that I do need to control by what I eat, and it's an important part of keeping things stable for me.
Very good. We did not mention anything about sodium. Are you doing anything about sodium restriction, and why do you think you need to be on that?
Well, I know that the connection to high blood pressure affects the kidneys, affects the entire body. So I tend not to add salt to what I'm cooking. Afterwards, I'll add a little bit, but it's more controlled that way. So yes, I've limited that greatly and try to avoid it when I can.
Right. We also did mention once, to make you aware, that there is plenty of food, especially processed food or canned food, that will not be salty, but it will contain a lot of sodium. So
Right.
It's always very important when you go grocery shopping to make sure that you look at the label to check the content of the sodium.
Well, the fewer processed foods I use, the better, since I'm able to control what I'm putting into my food. You know, if I tend not to use very many canned things. If I do, let's say, use a canned tomato product, I get the ones that say sodium free.
Very good.
So that makes that helps.
And I'm sure you remember about the protein restriction as well, the topic that we already covered during our conversation. Let's go to the next question. Do I have to worry about cholesterol if I have kidney disease? What would be your guess, Gani? We didn't cover a topic of cholesterol.
Well, I would say absolutely. They're all connected. So I know that it's not a matter of the dietary cholesterol that, you know, from the foods as much as from the refined foods that raise my cholesterol levels. So.
Very good. You are an expert at this time. So although cholesterol doesn't increase your creatinine level directly, cholesterol can deposit in the vessels that are delivering blood to your kidneys, and that independently can lead to renal insufficiency. So absolutely, watching the cholesterol is as important as watching your blood sugar and your blood pressure. Next question. I have taken medications and lowered my sugar, but it is still too high. What should I do? Well, my advice would be to definitely go and seek an advice from a physician. There is a specific blood work that you can do that is not reflecting just blood sugar at that particular moment, but shows the blood sugar, average blood sugar control for the previous 3 months. That's something called HbA1c or A1c. And obviously, if your sugar is not controlled, there are ways of controlling that. It may not be a pill. That may involve injecting insulin. And that's something that patients very often do not like, putting yet another needle in their body. But, well, I think it's worth it because a little bit of insulin can really save you from a lot of trouble and a lot of needles in the future. So if you take pills and your blood sugar is still elevated, make an appointment to see a physician ASAP. Another question. How do you, as a doctor, guide Annie to consider her heart and heart disease risk? Well, we always have at the end of our visit sort of a conversation, yes, and trying to link all the pieces of puzzles together, and we say that basic controlling everything from each side makes a big difference in not only in your kidney, but it's also preventing your heart disease and vascular disease, not only the strokes, not only the heart attack, not only peripheral vascular disease and decreased circulation in the legs, but overall well-being and hopefully feeling better and never needing the dialysis, right?
Oh, absolutely.
Another question. I was just diagnosed with kidney disease. The doctor said it's early stage. What does that mean? And how long do I have until I need dialysis or transplant? Well, we sort of covered the topic. Early stage kidney, doctors always like to classify everything into stages. But kidney stages comes in 5 different stages, 1, 2, 3, 4, and 5. 1 practically meaning that there is very little kidney damage, and 5 means that kidney is already basically exhausted and you need renal replacement therapy in form of dialysis or perhaps kidney transplantation. Early stage usually means that a doctor has in mind stage 1 or stage 2 chronic kidney disease, at which point there is really a lot of things you can do. You probably cannot bring yourself back to normal, but at this stage there's still a lot of things that you can do to slow down the progression. Probably you cannot stop it, but you can slow down the progression to stage 3 and stage 4 and stage 5. So hopefully the dialysis is never going to become a need. Another question. I have high blood pressure. Am I at risk for stroke or heart attack? What's the difference? Annie, you're an expert at this point.
Oh, no. I'm not an expert, but I do know that the risk is increased, especially when you have diabetes. Add to it any type of coronary issues and then kidney disease. So the chances of something happening are increased. I don't know at what level they're increased, but I know that unfortunately they go together and they need to be treated.
Very good. Of course, you're right. Blood pressure is an independent risk factor for kidney disease, and in conjunction with excellence in blood sugar control, the cholesterol control, all the dietary restriction that we discussed, it's really very important to keep your blood pressure under control. There are specific numbers. There are different numbers for people with different diseases. More or less, your blood pressure should be less than 130/70. And again, you might be surprised that at one point, even if your blood pressure is normal, so-called normal, let's say you go to your visit and your blood pressure is persistently within normal limit, a physician actually can't recommend a blood pressure medication regardless. And that is not just to lower your blood pressure, but provide an additional benefit to the kidney. There are specific medications that will not only lower your blood pressure, but they change also the way blood flows to the kidneys, so the kidney is receiving less damage and being more protected against diabetes and hypertension. Well, sorry to say, but we have run out of time, but in case we didn't get it around it, please check back on the National Kidney Foundation Facebook page, where we will be posting the answers to your questions. I also would like to remind you that the discussion on diabetes, cardiovascular disease, and kidney disease will continue at the same time and place tomorrow, where the talk will focus on how these issues relate to women's health. Now, on behalf of our partners at the National Kidney Foundation, Diabetes Sisters, and Women Heart Organization, I'd like to thank you for watching, and we hope you will be there tomorrow at the same time. Thanks again, and we wish you all good health and good luck.